Want to welcome you and thank you for joining us for our webinar sponsored by Cardinal Health, titled Side by Side, Helping Your Child Cope and Navigate Chronic Illness While Caring for Yourself. So a few housekeeping items before we get started. This is a webinar format, which means your camera and microphone will be off. We'll only be able to see the presenters. So while we won't be utilizing the chat or the raise hand feature, you can use the Q&A function in the toolbar at the top of your screen if you have any questions during the presentation, and then our presenter will answer them at the end of the presentation. We will be recording this webinar and it'll be made available on our website at oley.org/webinars. And just a reminder that the information provided during this and all of Oley's presentations are for educational purposes only and not intended as medical advice. So although clinical information is peer reviewed, you're advised to consult with your healthcare team before making changes to your care plan. All right, so before we get started, we'll do a quick poll to learn more about you. And so you'll just choose which option best represents you. Are you a consumer, a caregiver, or a clinician? So go ahead and complete that so we can get an idea of who's joining us today. Great, thank you for helping share a little bit about you. Before we dive into today's session, I want to take a moment to acknowledge Mental Health Awareness Month and the importance of mental health, especially for those on nutrition support. This journey can often feel isolating, but I'm so glad you're here today, part of a community that truly understands and cares. I'd also like to invite you to our upcoming webinar on May 20th, titled Navigating the Double Burden, Anxiety and Chronic Illness, as well as our community connections on May 27th. If you know someone who might be struggling, please invite them to join, even if they just listen, so they can see there's a place where they're supported and welcomed. All right, so without further ado, it is my pleasure to introduce our speaker. Stephanie Myotis, PhD and CSP, is a licensed psychologist and the founder of Next Step Psychology, a private practice based in New York City. She specializes in providing assessments, therapy, and parent coaching for children, adolescents, and young adults, as well as their families. Her areas of expertise include autism and developmental disabilities, medical complexity, and trauma. Dr. Myotis has been involved in psychology leadership at the local, state, and national levels, including holding several roles with the American Psychological Association. Across her work, she is committed to helping families navigate complex developmental and medical needs by fostering a deeper understanding of their children's unique strengths and challenges, and supporting both children and caregivers in building resilience and emotional wellness. So happy to have you here, Stephanie. I will turn the floor over to you. Thank you.
Thank you so much, Andrea, and the whole Oley Foundation. I'm excited to present today, and thank you everyone who is here today. Looking forward to speaking with all of you and for anyone who watches the recording later as well. So as Andrea said, I am a licensed psychologist in New York and Pennsylvania in private practice, located in New York City on the Upper East Side, and founder of Next Step Psychology. And I do work with children with chronic illnesses and their families and supporting in a variety of ways. And I'm excited to talk to you more about what that looks like in terms of what you can do as a parent or caregiver as well, and also as providers, how you can support parents and caregivers in supporting their children. So what we will be talking about today is first just the emotions that come with chronic illness for children, as well as their parents and caregivers. Then talking about chronic illness with children. What are the ways to do that in a developmentally appropriate way? Also building trust and connection specifically as children may have to be in the hospital or undergoing medical procedures, and how can that be done on the family level as well as the provider level. Then talking about emotion identification and regulation for children, how to support that, and most importantly, co-regulation. So really how parents and caregivers can support children in regulating their emotions. And then parent and caregiver wellness, as well as how providers can foster that as well. And then we'll open it up to questions. So to start, as I'm sure many providers and parents are aware, there's a number of emotional experiences for children that relate to chronic illness. So one of these being fear. This could be just the initial fear of what does this diagnosis mean, the fear of specific medical procedures, the fear of what's going to happen and the unknown. So there's a lot of fear that comes just with a diagnosis and then all the associated pieces after, especially if someone's had a negative medical experience in the past and what that could look like. So for children can have a lot of fear and need support with a lot of anger about the diagnosis of self, perhaps also just feeling like they're different and a lot of anger around that, but also kind of missed opportunities. Children with chronic illness have to miss a lot of school often, or miss social opportunities, or the amount of time it's taking away from other pieces of their life. So there can be a lot of anger around that as well. And sadness, it can be scary and just sad that they have a certain diagnosis, or again, these missed pieces of their life, or maybe they see their family sad and then they feel sad. So there's a lot of pieces here in a child's emotional experience. There's also confusion and uncertainty, which is really highlighted in children's emotional experiences. And that's why a lot of the pieces I'll be talking about today are really related to how to address this confusion and uncertainty. But for children, especially maybe being in the hospital often, or just at doctor's appointments in general, hearing a lot of medical terms thrown around, it can lead to what's going on with me. I'm not really sure, especially when these direct conversations aren't necessarily happening. And uncertainty, what is going to happen to me? Maybe their friend went to a hospital and something happened that was really scary. And they're like, is that going to happen to me? I'm not sure. So a lot of those pieces can be happening. Overall, there are higher rates of anxiety and depression for children with chronic illness than children in the general population without chronic illness. So this is really important to think about, especially because signs of anxiety and depression are often what we call internalizing symptoms. So these are things that are maybe you're not seeing on the outside of a child as much as them they're keeping inside, and it can be really hard to know if a child has anxiety and depression at times. So this is really important for a team to monitor for, to have mental health providers involved for that reason, and thinking about ways that these can be manifesting for children. Maybe they're really scared of going certain places. Maybe they're experiencing a lot of additional physical symptoms that are due to anxiety and not just the chronic illness. So maybe rapid heart rate, shortness of breath, those pieces. Maybe they're having difficulty eating or sleeping that's not related to the chronic illness, but rather related to depression, or just chronic sadness, fatigue, not really wanting to go anywhere, not enjoying the same activities. So really looking for those signs, and also thinking about how this may not necessarily present itself as the first thing that families are looking for, providers, especially with chronic illness, when people are so focused on that as well, but also really paying attention to the mental health experiences. It also can manifest through some behavioral challenges. So sometimes anxiety and depression can come out in different ways, different behaviors, maybe not wanting to follow certain directions, children being really angry and sad. So maybe they're screaming, or different pieces. And so being able to really view this through a lens of kind of a really traumatic and stressful experience for a lot of children of having chronic illness and the things that go along with it. And then also thinking about how all of these things are further impacted by these pieces of, first of all, for children who miss a lot of school and have to because of medical procedures and things, how that relates to their emotional experience. First of all, they may be then struggling a bit more academically, which can lead to increased anxiety and sadness around that, and kind of shame or difficulty with self-esteem, but also missing school. They just don't have that same routine. So it can be really difficult to adapt back when going. And also peer challenges. So part of it could be, again, just due to not being in school as much, it can be difficult to interact with peers, but also people may feel different. Some people may be bullied or not knowing how to explain why they're missing so much school to their peers and what that can be like. And again, just this feeling of I'm different. What does that mean? How do I talk about this? And so that can be a big piece as well for children's emotional experiences. And it's also important to think about parent and caregivers' mental health as well, and overall what is shown there. So similarly, you see higher rates of anxiety and depression. So these are big pieces of the picture for parents and caregivers. And so thinking about how this shows up in parents and how it can really affect children as well as the parent and the whole family system. Parents might be really nervous and be like pacing outside, and children are seeing this, right? Or become really depressed, and it's difficult to do anything except maybe focus on their child illness and treatment and supporting them. So this can lead to isolation and further depression. So these are all important things to think about. Just the stress, particularly with all the needs of a child with chronic illness. So thinking about all those added stressors, all the extra appointments, all the just the stress of worrying about them. So all of those pieces are really important. Research also shows increased levels of trauma symptoms in parents and caregivers of children with a chronic illness. So particularly looking at symptoms that you might see related to post-traumatic stress, you'll also see in parents. So thinking about what that might look like is kind of recurring memories of maybe a really stressful and traumatic experience where a child was rushed to the hospital or something like that. And so these pieces can come up. Similar to their children, there can be a lot of confusion and uncertainty for parents as well, especially when first getting a diagnosis, getting used to what this means for their child, not knowing what's going to happen next. These are all big pieces. There are also research really shows reduced sleep for these parents overall. And so what this means is twofold, right? Sleep has to do with mental health overall. So it can be harder to interact during the day, to do things during the day. It could be related to depression. It could be related to just being really anxious and having trouble falling asleep, as well as just having more things you have to do during a day, particularly for parents who have other children as well. Making sure to balance that can be really stressful, and it can lead to less sleeping. It overall is shown that particularly parent and caregiver mental health is really impacted by unmet needs, which is really important to think about on the provider end of how to better support parents and caregivers and their needs, and looking at what do they really need and what does their child really need, so we can improve mental health, which improves overall outcomes for children and families. And then also the child's quality of life, making sure that the child has the quality of life that the parent is looking for, socially, their health, all of these things, and how can we best support that to the greatest extent. And it's also shown that mental health is shaped by the level and intensity of caregiving demands. So thinking about ways that there's always going to be more caregiving demands when a child has a chronic illness, but how can this be supported? So for example, in some areas, respite services are offered for families, or maybe there's caregiving groups to provide support, or groups where children can go and feel supported that can help. Also just thinking about what the demands are and working individually with a family to address those. Okay, I'm really going to highlight this uncertainty piece because it's a big part of what's shown is impacting children and families overall. So to start out, the uncertainty comes at the beginning. So maybe not even knowing the diagnosis right? A family is seeing some concerns with their child. They bring them into a medical professional, but they really don't know what's going on. And maybe the first professional doesn't know what's going on, and they have to go to multiple doctors just to get diagnoses. So there's a lot of uncertainty just from the beginning that can really impact mental health. And then especially if someone's had to see multiple providers, it can be difficult to even build trust and know what's happening. And sometimes families and children can feel a lot of relief when they finally do get a diagnosis, but it could have taken a lot to get there just in the beginning. Then there's a lot of uncertainty specifically around illness progression and the prognosis. So what is going to happen next after this diagnosis? What does this look like for the rest of my life or my child's life, right? These are all things that happen. Then when treatment options are given, like how likely is this treatment to work and what does this mean? And children can be really confused about what a treatment really entails, what they need to do, how much work it might entail or time, right? And also what are the side effects of treatment? Thinking about that, all these pieces feel very uncertain, even when trying to support a family, especially when giving them so much information that's so important, but it can feel really overwhelming and uncertain about what's next. Also, what is really this impact on daily life actually going to look like, right? You could talk about it more in the abstract, but thinking about what is this going to look like for a child who wants to spend so much time with their friends, but now needs to go to a hospital multiple times a week? And how is this going to impact their school? How is this going to impact all the other areas of their life? How is this going to impact the whole family too? Other siblings in the family, the parents, and their life as well. And so thinking about that, everyone in the family and supporting everyone there. And then also finances. This can be a real stressor for families in terms of medical care, as well as logistics, thinking about when is a child going to get treatment? How does this impact a family's work? Some caregivers can't work full time anymore because of a child's chronic illness. So how is this having an impact? How is the child going to learn what is needed for their treatment if they have to do certain things on their own at a certain age? And also uncertainty about like how someone will cope, right? Like what to do. It's a whole new experience for so many children and families. And what support will they have? What will they do to manage? And what does managing even look like when there is this chronic stressor going on throughout life? So a term I want to bring up here, which I think is really important too, in considering in this whole context, and also what we're going to talk about next in kind of how to support the child, is medical trauma. So medical trauma relates to thinking about symptoms of post-traumatic stress, which are triggered by medical events. So this could have to do with just multiple hospitalizations or even one hospitalization, especially if really unexpected. It have to do with ongoing treatment, could be part of medical trauma. Very invasive procedures. There's a lot of things, but also really thinking about those like emergency situations that are so scary where a child wasn't expecting to go to hospital and then is hospitalized. So this can all come out in symptoms of post-traumatic stress, both for a child as well as parents and caregivers. So we can think about a number of ways you might be seeing this in your own child, as well as any parents or children you work with if you're a provider. So you might see avoidance. So you might see people wanting to miss appointments. Your child being like, I don't want to go anymore. I don't want to go for a treatment. Really like avoiding things that are scary for them, avoiding kind of taking medication maybe if something scary happened. So thinking about all these things that are really important for treatment and then trying to avoid it can be. You also might see really intrusive memories. So these can come up in maybe perhaps when sleeping. Sometimes people have nightmares, but you also might just have these memories popping in during the day. So like not intentionally thinking about the event, but it's just popping in and really impacting someone's day negatively. You can also see what's called symptoms of hyperarousal that occurs as part of post-traumatic stress. And what hyperarousal really looks like is being hypervigilant. So maybe, for example, someone had a really scary negative event medically, like a seizure, and then is constantly worried about that and thinking about it and really on guard. Or maybe you have someone who with type 1 diabetes who into DKA, and then you're going to have them kind of like constantly over checking and really worried, or a parent feeling that way as well. So you can have many things that are happening, and the complexity here is thinking really about there is an importance of kind of doing these things for your physical health, but also being able to make sure it's not overly impacting mental health in a way that's not needed. And keeping that balance between the physical and mental health too is really complex. So now moving here, when thinking about this emotional landscape we just talked about with children, parents, and caregivers, a really important piece of this is how to talk about chronic illness with your child. This can be really complicated for families, and sometimes families don't know what to say, or they just say, okay, you have this diagnosis, and children are left confused. Some parents and caregivers really do a great job, like getting in and talking to their kids and are doing these things, but some parents don't know where to start, which makes sense, and it's really confusing. So one of the main things is making sure it's an age-appropriate conversation. So I'm kind of going to break this down right now too, of like what this could look like in terms of age-appropriate. So when thinking about younger children, it's really important to have clear and simple explanations. You don't really want to get into the whole complexity, all of it. And another thing to highlight here is with these simple explanations, also making sure they're not kind of too scary in a way that's not necessary, but also being accurate. So you want to be like, you are going to need to take this IV because ... right? Whatever's going on. Or you need to take this medication for whatever reason. So explaining, and just because, so you won't be sick, or so whatever symptom might happen, right? So you want to focus on clear and simple explanations for children. But again, you don't want it to be overly scary, because sometimes parents really want their child to follow a treatment regimen, right? And we'll say certain things that can be overly scary to a child and they may have slight accuracy in them, but might not be the most accurate or most likely to happen. So keeping it clear, simple, and honest is really important. But for younger children, really using toys, stories, and videos can be so helpful. I'll have some books at the end, and anyone can reach out to me later for other ideas of books for specific diagnoses as well. But when thinking about toys, so sometimes it can be really helpful just to use dolls, stuffed animals, and talk about what's going on with the body, as well as what a medical procedure might look like. Using a doctor kit here can be really helpful. And so showing like what will happen and what's going to happen, and doing it on a doll. Let the child try it out on the doll and practice, and have the child play doctor. And then you can show, oh, maybe it's not going to go that way. Because this isn't just necessarily for play, but really showing what's going to happen and explaining for different parts of the body. Also using kind of videos, especially with favorite characters or stories, can be really helpful. You also really want to reassure children of this age that they didn't cause their chronic illness, because especially at this age, children are really likely to think they did something wrong that led to this. So a lot of reassurance is necessary. Then if you're thinking about elementary age children, you really want to focus on asking questions about what they understand after talking about their chronic illness with them. You want to check in for understanding, seeing what their own kind of story around it is. And with that, then you can correct for kind of things that are inaccurate while also supporting their emotions around it in their story. You also really want to clarify when something is not contagious, which is really important with chronic illness, because sometimes children, especially at this age, just think about being sick kind of in the idea of like a cold or something that is more contagious. So it's important to think about, because that can impact them socially, this perception. Now, really moving to preteens, and really teens as well can be included here, but in a bit more complexity with teens. But with preteens, you really want to use more specific examples of what's going on. That's really important. You can get more specific here. You want to assess for their understanding and then correct any misunderstandings again. And really encourage questions here. You want them to ask as many questions as they have and really provide them with accurate answers. Or if you don't know the answer, that's okay too, and say you'll figure out that answer together. Really important. Now, overall, really for all age groups here, as I've mentioned, so you want to balance honesty and reassurance. So as I was trying to get at before, it's so important that everything you're saying is very honest, and also you want to be reassuring while remaining honest, which can be a hard balance to really strike. So it wants to be clear and accurate, and you want to talk about that, the importance of treatment and the things that could go wrong without treatment, right? But at the same time, providing the reassurance that you're in this together, are getting the treatment you need, and just being honest about what's happening every step of the way. Again, giving clear explanations that are tailored to the child's developmental level, what it's looking like. For anyone who wants to think about this for a specific diagnosis, feel free to reach out to me because this can really vary, but really just focusing on kind of what needs to be done and what is happening. If it's a certain part of their body affected, talking about that in an age appropriate way. Again, you can use dolls if someone's not going to really understand what part of the body is, or saying like this part of your body is in pain because of this. Naming a diagnosis can be really helpful for children too, and really highlighting that other children have this diagnosis so they don't feel like it's something just going on with them. You also want to really encourage questions from children, even really young children, to the best way they can. But it's so important that children can just share what they're wondering, so they feel like it's an open conversation and they're not keeping all those questions inside and you don't know what they're questioning. Because when children have questions and they don't ask them and get answers, they tend to come up with narratives for themselves. And when that happens, it can be something really negative at times about the cause of something, what's going to happen, and those answers they give themselves might not be accurate and maybe increasing anxiety and depression. You also really want to provide guidance in answering questions, particularly to peers. So maybe there is something about like not going to school, right? So in those cases, how do they navigate answering that? Do they want to share their diagnosis? Do they want to talk about it? Maybe it's a child with an insulin pump, right? And they need to answer questions or feel like they need to because people are asking. And so those are all pieces that you can navigate with a child and talk about and prep. Like you can go through kind of a role play or a script of like, what might you want to say to your friends? Do you feel comfortable sharing? What is this going to look like? And that can really help prepare them for what could happen and a lot of questions they might get. You also, when talking about illness with your child, you want to really encourage emotional expression while providing support. So not just talking about everything factually, but giving room for the child to talk about how they're feeling. That way it becomes an open conversation and really helps with monitoring mental health and supporting it and really supporting them in exploring those emotions. For older children especially, but for all children to the extent possible, you want to involve them in discussions and choices about their care. When talking about this is really important that they feel some autonomy. Children, especially who have a lot of medical procedures, can feel like they don't have a lot of control in their life, which sometimes can lead to kind of some behavior concerns because they're seeking control in that way. But also it can just lead to a lot of negative mental health implications when you feel like you have no control over your body and yourself. And that can be really difficult, especially as getting older and teens want to have more and more control over their bodies. So you want them as involved as possible in their care overall and in discussions about that, about what's going to happen next. Maybe a decision needs to be made. Older children especially, how can they be involved in this conversation? Listening to what they have to say. So not just involving them, but really listening to the extent possible. And starting younger in some ways and gradually getting them more involved in their care, first of all, helps, especially if there's something they have to do for their own treatment. Starting them young and getting them involved with the proper support for their age. So I'm not saying a young child should be completely doing a lot of their treatment regimen on their own, but thinking about what are they going to need to learn? What are the steps they need to get there as they get older? This is going to really help it just become part of a routine, because sometimes starting much later as a teen, teens might not want to do it. And especially if someone's been doing it for them all along and they've kind of felt like they had no control, it kind of may feel like, okay, well, now I can choose. And I'm like, I'm not going to do this anymore. So building it into a routine for a child and gradually helping them get there and really understanding the ways that they are like, this is needed and important for their health, but also trying to maintain as much normalcy in their life as possible is really important there for autonomy. And then preparing a child for what to expect. So to the best of your ability, also knowing that there's uncertainty and acknowledging that for a child, but what is going to happen in a medical procedure? Talk to a provider, help them help maybe, again, with like a doll for a younger child. See like what is going to happen next. Let them ask questions. Those are all important when talking about chronic illness. Then thinking about medical care, such a critical piece of this is building trust and connection. So both between the parent and child, as well as the provider and parent and provider and child. So all of these pieces. So part of this is just active listening and empathy. So really listening to what is the child saying. Are there things that can make the child more comfortable that are being missed because people aren't listening? Are there pieces that maybe have to happen that make the child uncomfortable, but how can that be addressed? How can that be talked about and validated? Again, as I mentioned, so critical, involve the child in decision-making as much as possible, even if this is such a small decision. So let's say like they can't make a lot of decisions about their treatment, right? But they needed their blood drawn multiple times and the child really hates it. Just letting them choose what character Band-Aid they have at the end for a small child. So thinking about ways that they're just having choices throughout the process and are involved. Really thinking about what effective communication looks like, that you're clear, that you're leaving room for questions, that you're talking about what's going on, just that everyone is kind of in the know every step of the way, preparing for procedures, taking time and not just being like, oh, this is happening today, right? Giving the child time to understand what their procedure will be like, especially when you can have time to prepare. A really critical piece is also maintaining routines in unpredictable settings. So finding a way that some routines can remain. So maybe a child always has a story read to them at night. So even if they have to stay over in a hospital, making sure you have some books there for them and maybe bringing books from home. So it's books that are familiar and giving the child a choice of the book. So those are all pieces where you can still keep as much as routine as possible in this different setting. Having comforting items. So if a child has a certain favorite toy or a favorite blanket, making sure those are present as much as possible as well. Remaining present. And so I highlight this because it's so important. And so part of it is being present physically, but also just emotionally and kind of mentally in general, which can be really hard because parents are really stressed too, especially if a child's about to have a medical procedure. So sometimes it can be like the parent's there, but they're just so worried themselves that it can kind of feel like they're checking out mentally and like they're right there and care so much. But because they care, it's kind of hard to remain present. So it's really important for parents and caregivers to remain present. And at the same time, that's why it's so important that parents and caregivers have the support they need so they are able to remain present in that moment and feel supported as well. And then also to build this trust and connection, it's important to encourage self-management, like I mentioned before, to the extent possible. So children will have more trust in the procedures and what's happening if they've started to learn to manage their own treatment to the extent possible. They understand a bit more about what's going on, why it's important. This helps with their medical care in general. And for providers, it's important to build relationships with families. Typically, families with chronic illness are with treatment teams for a while. So this relationship building will just help in general for long-term care. Then another piece of this in supporting children then is helping them name their emotions. And this is a big part for children in general, but especially children with chronic illness. And so why this matters. So naming emotions helps reduce the intensity of emotion. So there's this concept of like name it to tame it. So of course it doesn't do this like automatically, but it's kind of like this first step of like understanding what is going on for a person. Can it, especially when you're having a lot of uncertainty and a lot of things going on with your body in general medically, it can be confusing if you're having all these things come up, these feelings, and not sure what's going on. So it can be helpful to have like a name for what's happening, and it can give you an idea of what to do next. It helps you then connect that again to the long-term coping skills. And then it can build trust when a child is like, oh, this person knows I'm feeling this way. I was able to express it. And so then what are some tools to help children with this? So there's visual supports. So it's focusing on some people use emotion faces, feeling thermometers. And so it's not just handing a child one of these, but really using these and teaching them how to use it. So you can teach, especially for children that might struggle with emotion identification, you can use one of these charts and show them what this might look like. I have some examples and I'll come back. So here, you might want to incorporate their interests. Here I have a bluey one for a child who likes bluey. And so you talk about each one. What does excited feel like? And so maybe as a parent, you're modeling what excited feels like and talking about how it might feel in the body. What are examples of the time you might be excited? Like someone might be excited because it's their birthday or they're going on a trip to their favorite place. And so talking about what that might feel like for someone in their body, maybe and what actions they may take. Maybe they feel like they want to jump around or they want to like tell everyone about it. There's different things that might be happening associated with the feeling. And then you also might have a feelings thermometer. This one actually shows like kind of what you do when you're feeling different things, but you can have them kind of give examples of where they might be at each part of the thermometer and talk about those yourself too. And so that way, when they're having a feeling, if they're having trouble expressing it, bringing out these visuals can be helpful in talking about this again. You can also use books and stories. And so making sure these are age appropriate narratives that just model emotional expression. So again, I have one example here. This is a little spot of emotion box that talks about different types of emotions that someone can have, but there's a lot of examples of these, and using these can be helpful in kids understanding. You can also create what are called like social stories, but just stories that maybe involve the kid in it in a narrative too, right? It can talk about what their emotion might be in relation to a specific procedure and making a book that has like their face in it or a character that they really like, or just they can choose a character that's going to be in all their stories that can kind of be like the pseudo them in their books about what's going to happen next and what the emotions might be related. You can also do daily check-ins, just of like a how are you feeling today? Using these visuals are simple words and it just being built in your day. So it's a common part of that the child knows they're going to tell you how they're feeling. Maybe when they come home from school, maybe right before a medical procedure or right after. Especially for younger children, there's a lot around play and art that can be used. So drawing feelings, using voice or role play to express emotions. Those are all pieces. Then what happens next is thinking about emotion regulation. So importantly, again, tailoring by age and development and what this is going to look like. So again, might involve more play for younger children and more kind of cognitive and thinking and talking for older children. Emotion regulation also can involve some breathing exercises. So there's different ways to do this. I have some here, but there's others too. Some people like do a trace the 8 kind of thing. Some people do like bubble blowing, and there's videos for this as well that can help children in learning to do different breathing exercises. There's like a smell the flower, blow out the candles for the in and out, but children like belly breaths and use them in school often. It's really important to help children be really aware of their body too. So you can use different sensory tools for this, for understanding their body and for calming, but also in just like naming like parts of the body and how it's feeling and kind of connecting that to what's going on for them. And this is particularly important for children who can have a lot of invasive procedures sometimes to their body and needed for their treatment. Having predictable routines as much as possible. Maybe it's keeping appointments the same day as much as possible, or however, a structure at home that really helps them. But this creates emotional safety and lowers stress. Then having calm down strategies. So sometimes this is like creating a calm corner where it has like activities that calm someone or just kind of favorite things where they can relax. Sometimes children need emotion cards that they can like show how they're feeling, or like an I need a break card can be really helpful if a child's like struggling to really express that, but it's like I need a break and then they know they need a break. Also knowing when they can take a break versus not, or also maybe they have an I need a break card, but they can't take a break from whatever they're accessing, especially if it's treatment. But maybe there's a time when they can take a break. So the provider knowing that can also be like, okay, we can't take a break now, but acknowledge they need a break and be like, okay, I'm going to set a timer. We can have a break in so many minutes. So this will really all depend. Or if there can't be breaks, how can as many like calming things be put in place? These things. For older children, you might think of a lot of cognitive strategies, like I said, or using self-talk. So especially kind of like positive self-talk can involve just saying like, I can do this, using examples of when you've been able to do this to kind of restructure like negative thoughts that everything is going to go wrong, thinking about times when things have gone more positively, or kind of just shifting different pieces for yourself depending on the exact situation. What I completely want to highlight here, though, is co-regulation. So this is caregivers providing external support to help children manage their emotions and behaviors. Why I think this is the most important piece, particularly for younger children, but for all children in general, is we talk a lot about children not being able to regulate their emotions and having difficulty, especially in mental health. But for young children especially, they don't really know how to do that yet. And it's very normative at their age and development level that they're not able to do that. So the piece that really comes in is co-regulation, is the parent or caregiver being able to help them do that. And to do that, the parent and caregiver needs to have the skills to be able to regulate their own emotions so they can show that and help their child through that. And that's the key piece here. So part of it is just modeling calm for a child and like what that looks like in their daily life as much as possible. There'll be times when that's not possible, but trying to do that as much as possible, because if a parent or caregiver doesn't feel calm, the child isn't going to either. Using a really soothing voice, staying present with the child can be really important. Really explicitly acknowledging a child's emotional expressions, naming it for the child if they're not able to name it themselves, what you're seeing, and helping them process their emotions and what's going on for them. You also want to guide appropriate emotional responses while providing validation. So it's never that the emotion is wrong, but sometimes the associated behavior is what is wanting to change. So you want to validate that this is scary, this is sad, you feel angry, and that makes sense. And also, then what do we do next? And so doing that with the child, modeling those things, helping the child make decisions about what might be an appropriate way to respond when feeling those things and how that can help, but that the emotion is never wrong, and validating how they're feeling. And then honesty about their own emotions while displaying self-regulation. So this can be really hard as a parent or caregiver, because maybe you want to feel like, okay, I'm being strong for my child and all those pieces, but it can sometimes feel really isolating. And of course, you have to know your own child too, but it can feel really isolating for a child to be like, I'm so scared, like, isn't anyone else scared, or what's going on, or why does my parent or caregiver feel like kind of checked out of this process? And maybe it's because they're also scared, but the child not knowing that can be really confusing. So there is an opportunity here to be really honest of like, you're scared and I'm scared too, or you're angry and I'm angry too, and then display that self-regulation and like, and this is how I handle it. That's a really great form of modeling for a child and helping them feel less alone. Then it's super important to also care for yourself as a caregiver. I know this is way easier said than done too. So I think the first piece I want to highlight here is just redefining self-care. So this doesn't always have to be these big self-care efforts that feel like they take too much time and are not really possible. And it's more about small and sustainable practices that can be built into your day, and not necessarily aligning with what someone else considers self-care, but what is your own self-care? What can that look like? And then incorporating some stress management things that have been shown, particularly for parents of children with chronic illness, but some grounding exercises. So for some people that involves a lot of sensory things. Some people do like the 5 senses and finding like 5 things they see, 4 things they hear, for example. For some people, it could be something that just like brings you back. So like it could be like having a sour candy, like snapping a rubber band against your wrist, just different things. Then especially if like having a lot of kind of negative thoughts or that are like around fear or sadness, can kind of reframe those thoughts to something more positive, but yet accurate. So you don't want to just be like kind of positive in a way that's not accurate, but thinking about, okay, maybe everything isn't going to go wrong here. This treatment has gone well all the other times in the past. So kind of reframing that there. But also there can maybe times when it's just you need to accept that you're experiencing a negative emotion, but still figure out what are the actions you still need to take to move forward, even knowing that, okay, I accepted this. Also setting appropriate boundaries, especially around other things in your life. If you have so much happening in your child's care, the ability to ask for help too. And also, especially for older children, as I mentioned before, gradually transferring those responsibilities over to them will not only benefit them, but also helps to reduce stress in the long term because you know that they're prepared. And also, gradually, you'll have less responsibilities as well. And then just where can you find support? So finding other parents. This can be helpful for you as a parent, but also with the other children. Finding support from providers and having those connections, getting education and training so you feel really confident in what you're doing moving forward, and that understanding and that reducing uncertainty, and just having your own personal support systems to the extent possible and finding new ways to find those. And then just thinking about building family resilience, you want to reinforce confidence in abilities, this being your own abilities as a parent and what you're doing moving forward, and also your child's strengths and what that and how that is all coming into play in your family. And you adapt to new routines and roles when there's a child with a diagnosis. So thinking about what do your routines look like now? What is this going to look like for our family? And what is the role of everyone in the family? Thinking about siblings of children with chronic illness as well. What do the parents have to do? What does the child with a chronic illness have to do? How has this affected all the roles in the family? And having open conversations about this. And also improving communication in both directions, asking questions, answering questions. All of those are really important. In all roles here. And so you want to improve communication with providers as well as with your child, and having your child be able to really openly discuss what's going on. Now, to conclude here, really the role of providers is thinking about enhancing caregiver support. So what is their training? What is their education? Are they really understanding? Checking for their understanding. Building a trusting relationship with the provider, the providers and families, as well as with the child. So that's really important, especially for long-term care. Actively listening to what's going on and adjusting based on that, not just listening, but something is really not working for the family and can be adjusted, adjust, especially if a treatment plan isn't really working or it's really impacting a child negatively. Maybe they're missing their favorite field trip. And if the appointment was moved one day and it's able to be moved one day, it's moved. So thinking about what's going on and can positively impact the child, not just their physical health, which is super important, but their mental health as well. And providing honest information to families as well as the child, exploring the family and child's fears and hopes, and really understanding that, because there might be ways to address that. Maybe a child has a fear that really doesn't relate to their treatment, and being able to describe that to them, understanding their hopes and how you can support them in getting there. Having collaborative goals and working on those together is so important, and involving parents and children in the treatment planning, and or also just telling them what is the goal, what do you want to happen here. Supporting self-management of children, so helping them learn techniques to help them with their own treatment, to manage chronic illness, what that's going to look like. Making sure to think about trauma-informed practices and family-centered care. So thinking about this through the lens of chronic illness and constant medical care could have many aspects of medical trauma, and you might see symptoms of post-traumatic stress. So how are we seeing behaviors as communicating that something is really scary or that someone has experienced trauma, and what is a child trying to communicate through their behaviors, and how can we support them? And also focusing on the whole family's care. Providing compassion and validation. This is so important, that when a child does express their emotions, that is validated and heard and understood, so that they feel like they can keep sharing those things and aren't kind of internalizing those things. Supporting caregivers' trust and giving them as many resources as possible, and just making space for emotions in general as part of the process. Here are some resources. The Kids Health website has a lot of resources for parents, children, and teens. These are just a few books. There's others. Again, I said anyone can reach out if interested. This is about going to the hospital, learning about diabetes, about chemo, about asthma, but there's many other books if anyone has a specific thing they're looking for. And thank you. I'm really open to any questions that anyone might have put. And then also here's my information. I know they're going to put it in the chat, I believe, as well. You can connect with me on any social media with my practice, or reach out to me directly at my email or website if you have any more specific questions that might not make sense in the larger group, or if you're watching the recording.
Thank you so much, Stephanie.
Yes.
All right. Well, while we wait for some questions, I wanted to ask a quick question. So do you have any like simple everyday practices that families can kind of build into their routines to like support emotional resilience?
Yeah, definitely. I think, and this all depends on the child. So I want to say, like, for some children, some of these don't work and do. So don't like, I always like to caveat this with all families, don't like repetitively do something if your child's telling you it's not working or it's not working for you. But some families, for example, build in like a really brief meditation, and I have seen kids really like this. So for some kids, it's maybe the beginning of their day. If your kid doesn't like the morning, you might not want to do that at the beginning of your day. Maybe you want to do it more end of your day, but it can be something you do together as a family. It can be a really short, like 5 minutes, 10 minutes. And I've also seen like kids kind of do this together. Something I've also done that a lot of kids like, especially with this, is like a yoga wheel. So they kind of sell these, but you can like, it's a yoga spinner and it tells you what yoga move to do. And some kids build that into their day too, which can be like a fun practice. And then kids start doing it a little on their own. So these are good like skills to teach because kids start doing them at home. Similarly, doing some of the breathing things with videos. Kids really like the videos. So building those into your day. Other pieces could just be music. So sometimes having a kid pick a song that relates to how they're feeling for the day and sharing it with you and talking about it can be really nice. Or kids who like kind of the outdoors, maybe like building in like a 10 to 20-minute walk. So there's just different things that can work.
Love those. Thank you. Um, how can parents advocate for their children's mental health needs within medical or school systems?
Yeah, no, that's an excellent question. So I'll talk first about, I guess, medical, but also school. So medical systems, I think a big piece is first seeing, well, if you're in a hospital setting, especially seeing if they have a mental health team and just specifically asking if one can be added to your case. Sometimes it is as simple as that, that there is like a designated mental health team at hospitals for this reason. But sometimes the providers are the one kind of identifying which cases need it or not, and may not realize you need that or your child needs that. So it should just be asking if this is a service the hospital provides. But if not, also asking just for kind of referrals to outside providers, and then really just starting with encouraging them to communicate. Providers hopefully tend to like to collaborate, a lot do. So it can be really important that that mental health provider is helping you do that because you already have so many things as a parent going on. So having them communicate what the mental health needs are going on, but then the mental health provider can better understand the physical needs, and they're really in collaboration. And I would say pretty similarly at school, I think starting off with a lot of children, especially with chronic illness, might have like a 504 plan, right? That can help them. But as part of that, you can add in things with mental health. It doesn't just have to be about supporting their physical health. So when you go for updating a 504 plan or for initial plan for their needs, this can involve mental health needs, or some children might even have an IEP or an individualized education program. So similarly, this can look at mental health needs. You can get some counseling through school. Usually this is really brief, so I always like to tell that to parents because you don't want to pull kids out of like academics for too long, but those check-ins can be really helpful. So maybe the child has a check-in midday, right, about how they're doing in school. And also, I think to the extent families feel comfortable really sharing with teachers what's going on medically for a child can be really helpful in just advocating for their mental health needs, because sometimes they don't really know, and not just giving the diagnosis, because kind of like I talked about, maybe they don't really understand everything this diagnosis entails, right? A teacher who hasn't had to handle this before. So having an open communication with the teacher as much as they want to and collaborating there. But you can also bring in the mental health professionals in a school. So if there's a school psychologist, a school social worker, school counselor, they can all be involved in supporting as well.
Great, thank you. And I'm sure that you could do a whole presentation just on siblings, but I feel like they often take on a quiet burden. How can parents recognize and support their emotional needs?
Yeah, I think that's so important. I mean, I think first of all, looking kind of for the same signs I mentioned for the child too, but kind of looking more for those internalizing things. So seeing if maybe a child's becoming more withdrawn, not wanting to do the same things they were always doing before. If you're seeing increased anxiety, they can have so much anxiety as well. They don't know what's going on. So looking for all those same signs, and really highly encourage normally having their own therapist in some way can be so helpful, so they feel like they have their own attention and space, particularly. And then as much as possible, having like an hour a day dedicated to them, like just different things that involve them. But a lot of these same techniques can be used with the siblings, right? Having open conversations about emotions, validating those emotions, asking questions. What do you understand about your sibling's diagnosis? What are you thinking? What are you scared about? And but also asking the question of like, how is this affecting you? And kind of leaving room for that. And I think modeling that, right? Of being like, I lost a lot of my time too as a parent, like saying those things, because a child might not feel comfortable because they might feel like they're complaining about their sibling when that's not their intention. But I think in some ways, modeling it in a way that's not like blaming the child with a chronic illness, but at the same time explaining how it's impacted everyone. Like it's really impacted your siblings because they have to go to all these appointments. It's scary. They have all these things happening in their body. It's really hard for me too. I spend all my time doing this because I love your siblings so much. And how is it affecting you? Right. So kind of asking those questions and using similar things, but tailored a bit differently to siblings.
Thank you. Okay, so we do have another question. So, all the needles, the pain factors that are unavoidable. Looks like they're asking for resource info. So it can maybe how to support their children with, needles and pain from procedures.
Yeah. So I can give some ideas. And then if you're looking for very specific resources, feel free to reach out to me and I can like send some things too. But in terms of like ideas, again, if you have a younger child, sometimes it's really helpful to like do needles like with a toy. Like I've had kids where they just like to do it on me, like with a toy needle, and kind of giving them some control, although they won't have control in the real situation, but showing like, oh, I can do this too. Like, what's this going to look like? And there really is a lot of fear and pain, but it can be slow, especially if you have a medical provider open to kind of gradual exposure. So it can start by just like looking at the needle, right? It can then be moving, just like holding the needle on the skin, but not using it yet. So this can help like gradually expose a child who is really fearful of needles and the associated pain. And over time, it's showing, first of all, that maybe it's not as scary as they think, but also with it being scary, that they can tolerate the distress too. But it also helps if you're modeling that too, because if you're like, oh no, this is going to be the scariest thing, that can be really scary for a child too. So kind of modeling, validating like this is scary, but not overdoing kind of the fear around it is important.
Great, thank you. And I guess, so a lot more talk in the world of cannabis, and so a parent is asking if you recommend that to assist with anxiety and pain management.
I think so. For me, as like a psychologist and not a psychiatrist, that's not typically an area I necessarily recommend or don't recommend. But I would like recommend, like, again, this is a situation of talking to your own doctors, psychiatrists, whatever providers you have, and seeing what would work best for your family.
Yes, I agree. All right, perfect. Well, those are all of our questions. And for our attendees, Melissa has put in the chat Stephanie's email address and her website. And so you're welcome to reach out to her with any questions. And I guess, as we close, is there one message or a piece of encouragement that you'd like to leave with families, especially those who may be feeling, overwhelmed right now about supporting mental health while navigating these complex challenges?
I think as complex as it is, I would say the takeaway message, and hopefully the most important thing, is just like these open conversations. So even if you're unsure what to do, just continuing to have the conversations, being honest in them is really the most important thing. That will keep fostering the relationship with your child and help them be able to express their emotions too. Even if you're confused, having all these feelings too, just keeping that open and just validating what they're feeling. And so not like shying away from those emotions, like just moving towards them.
I love it. Thank you. Thank you so much, Stephanie, for sharing your time and your expertise and personal experience with us. It was incredibly informative. And thank you so much to everyone who attended. This recording will be made available on our website at oli.org/webinars. If you have any questions, you can email us at info@ole.org. And if you're not already, make sure you're following Ole's social media channels and getting our emails to receive updates. We have a lot of great events planned. And then, of course, our annual conference coming up June 17th through 20th in Charleston, South Carolina. You can check out more on our website or email us. But thank you again, Dr. Mattis. An extra thanks to Cardinal Health for sponsoring this webinar. So thank you all and have a wonderful day.
Thank you. Thanks,
Bye.
everyone.